Hello, everybody. Welcome back. Here I am again on the sunny, sandy beaches of Spiro, Oklahoma. So we're going to talk today about preparing for an ergonomic assessment. And so let's get started. So we've talked about many ways to do ergonomic, or we're going to talk about many ways to do ergonomic assessments. But before you even start an assessment, there's some things you ought to be doing here to prep for a little bit. And this is a little bit of introduction. There's simple and complicated methods for the analysis of physical workplace risk factors, but they can be generalized in 4 categories: checklist, interactive, form-based, observational, direct measurement. No single assessment tool is perfect. We know that. This whole chapter 14 focuses on the observational methods, but urges the practitioner to use other methods where appropriate. So you got to have the method that's going to fit what's going on there. The checklist is nice because it's easy to use. Special equipment required, gives you reminders what to do. I like checklists personally for a lot of different things. Cons are easily misused, observer bias, and not very flexible. Interactive form-based, pros can be validated, potential respondent anonymity, sample large population quickly. Cons, responder bias, it's costly to validate. Interactive formats, when you give somebody something to fill out. And nowadays, of course, they can probably do it on their phone. Observational, pros, easy to use, flexible, and can be validated. Cons, observer bias, observer presence can alter environment. That happens sometimes. So let's face it, whenever they see the safety person coming, they try to act safe. Direct measurement, pros can be validated and reliable. Cons, equipment can be costly. Tested environment may not represent true working conditions. And equipment presence, again, can alter work methods. So preparation is what we're going to talk about now for an environment. And preparation for an observational assessment is very similar to conducting a JHA or a JSA. The evaluator should become familiar with the technique they intend to employ and practice using the tool before entering the work site. In other words, you got to know what you're doing before you do it. Step 1 is select a job or task for observation. How you do this? Well, the tried and true method. Look at your workers' comp claims or injury logs or OSHA logs. Employee turnover. Why? That's a good point too. They may not turn up on an injury log or workers' comp claims, but if you have a department where people are leaving in droves, there could be something wrong there, and it could be something they're getting hurt and just not reporting it and just don't want to put up with it. Query workers and supervise on the following: which tasks are the most awkward or require the most uncomfortable postures? What tasks take the most effort? Which tool or piece of equipment is notoriously hard to work with? Have there been changes in processes or procedures? Visually assess the job or tasks, looking for the ergonomic risk factors that occur for durations longer than 4 hours a day, roughly, or as frequently as 3 times a week. Those are rough numbers. It depends. Use your judgment. Step 2, in preparation of the site visit, the appropriate office should be notified. For example, industrial hygiene, safety, or occupational medicine. This is for a big company if you have a lot of different offices. It can be helpful to invite someone from the respective office to attend a site visit. After the visit, these same personnel may be integral in implementing interventions. Select a time representative of the task or job being evaluated and plan to spend 4 to 6 hours in the work area. Step 3, become knowledgeable about the area you plan to enter. Obtain permission from the supervisor to enter the area and speak to employees so that everyone understands the purpose, process, and expected outcome. Determine the sample size, the square root of number of operators in a similar exposure category, or the most and least experienced operator, but there's probably a good idea, most and least experienced operator. The experienced people, like I said many times before, the people out there doing the job are the ones that are going to know more about it than anybody else. Research industries with similar jobs or tasks, looking for best practices or lessons learned, benchmarking. Become familiar with the process by reading standard operating procedures, taking an initial walkthrough and or discussion with management. Step 4, gather the appropriate tools you're going to need for the assessment. You're always going to need a measuring tape, digital or digital camera. Everybody has one of those pockets anymore. Notepad and writing utensils, all PPE that you're required for that task, that area you're going to be in. You need to know that going in. A light meter, maybe Force weight measuring devices, that's very possible. You might need that. And be sure to calibrate equipment pre and post sampling. Gather data. Step 5, introduce yourself and explain the purpose of the site visit. Explain what ergonomics is if the employees and supervisors are not knowledgeable. Explain that the purpose of the survey is to help the worker and it's not an inspection. Don't, if it is an inspection, by all means, you tell them that, but this is not. So it's not an inspection. So remember, it can be difficult for workers and supervisors to accept a suggested change if they have been performing the task the same way for years. Be understanding and make suggestions, not demands. If an employee is reluctant to change, ask them to try it for a few days. That's a problem in anything, really. People just don't like to change. And I kind of put myself in that category a good bit too. I don't really like to change, but you have to do it sometimes. And I certainly have done it many times over the years, but not always something I look forward to. Obtain job or task information, which is primarily accomplished through the interview of the supervisor or the designated escort. They'll seek frequently, the supervisor will help give you somebody that's knowledgeable to kind of guide you through the place and explain things to you a little bit. The job name, department, who's to contact, how long is the shift, what are the production standards, is there a rotation schedule in the shift, how many employees, level of turnover or absenteeism, workplace injuries, again, PPE, again, we talked about that. Is there seasonal work or production fluctuations, number and frequency of rest breaks, process improvement suggestions, total exposure time at each subtask or workstation. Gather user data by interviewing employees, length of time at the job, ask the operator to walk them through the tasks, any pain or discomfort associated with the job, ask them that. Number of duration of breaks, ask the operator too, or the people, their worker. Involvement in safety and health committees. What are the hardest tasks associated with the job? By all means, ask the person doing the job this stuff. What tools and pieces of equipment are notoriously difficult to work with? Do they have any previously diagnosed work-related musculoskeletal disorders? Or are they under a physician's care for a WMSD? What would they change if they could? Now you're asking them about work-related stuff here, so it's not confidential. If you're in the safety department, you're trying to do this, so they can tell you that, but they can talk about that with you. What would they change if they could? That's a good question. What would they change if they could? Ask them that. You might be surprised. Do not interfere with the normal process or discuss personnel issues. Avoid leading questions about pain or discomfort. Typically, answers are more accurate when workers are not interviewed in groups. I'm all for that 100%. I don't want to be, you don't want to interview employees in groups as a rule. Perform the task analysis by first observing the entire work area and then dividing the major tasks into subtasks. Alternatively, use the information collected from the interviews on where to focus the assessment. Reference assessment tools for specific procedures related to the tool of choice. Each subtask is typically examined for the determination of exposure to ergonomic risk factors. You're always looking for ergonomic risk factors. Examples of ergonomic risk factors: job constraints, risk factors include bending, stretching, twisting, static loads, maintaining undesirable postures, which we call awkward postures, tasks associated with the job and frequency. So you have repetition, duration, frequency, repetition. So those awkward postures, forces. So all those are the main three: awkward postures, forces, and repetition are the big three when it comes to ergonomic risk factors. Measure parts and tool weights, so that they have a part they handle or tools, and measure how much does this tool weigh. Just looking at it, not always can tell you that. Grip forces and push-pull forces if you can. Work heights, not how high they off the ground, but how high the work is from the work area or from the workstation surface. Reach and carry distances, seat height, cart locations, product dimensions and weights. A lot of information you need to gather on this. Examples of, what tools are being used. Let them show you that tool and how to use it. Draw a diagram of the process flow if it's more than this basic. Employ the proper survey tool. Note organization of work surfaces and process flow. Is there wasted movement or material handling? Video recording or photographs are an important piece of documentation. Video can be played back in slow motion and used as a training tool. some video and photo considerations, record from a variety of angles, record at least 2 of 5 angles, record both wide angle and close-up. If feasible, record at least 3 cycles of a task, and carry backup supplies, battery, memory cards, etc., so you don't run out in the middle of something. Upon conclusion of the data gathering, thank everyone for their time and cooperation. Inform them of the expected outcome or report. You might not know that they might not know the actual results of it yet, but obtain contact information for follow-up questions, which you probably should have already gotten. Brief appropriate personnel on the findings in general and when they expect a copy of the outcome. And if time permits, conduct a brainstorming session with employees, safety, and industrial hygiene personnel. Analyze the data. Analyze the data to determine if risk factors are present in a sufficient dose to increase the risk of injury. Incorporate the findings from all the methods employed during data gathering. If possible, brainstorm solutions with others during the report writing stage. Report elements can include the following: history and background, why the survey was requested, injury history, actual potential cost, OSHA rates, workers' comp claims, and what implications there could be for what happens here. How might that go on to something further? Workplace summary, the task summary, demographics, number, age, gender of workers, reports of any discomfort the workers might have had. Survey findings, summarize the methods you use to identify the risk factors, summarize the risk factor exposure, illustrate with photographs or video stills, include the results of the evaluation and method used, discuss consequences of current design. Recommendations, short and long-term solutions, detail each recommendation and how it will address the identified problems, include include diagrams of workstation or workflow suggestions, provide sources for tools, equipment changes, detail administrative controls and training recommendations. They can be quite involved, so you might want to get some detail on that. Cost summary for short and long-term recommendations, cost, benefit, and payback projections if you have that data, provide assumptions and relate to current workers' compensation, productivity, and missions readiness issues. Distribute the report. Assist with implementation of recommendations and follow-up. Remember the rule 1 of project management, the first 90% of a project takes up 90% of the time allotted to the project, and the last 10% of the project takes up the other 90% of the time. So project managers, projects always go over. It's just like a given. So the dog misses the rains down in Africa. I hope everybody gets that. What's the dog's name, and you'll figure it out. Well, that's it on preparing. I hope you'll feel a little bit more prepared for an ergonomic assessment. And that'll do it for this session.